This is the KBOI Medical Moment. It's brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence. Dr. Bramwell, good morning.
Morning, gentlemen.
Good morning. Now, Doctor, we've all read and heard and watched the news reports over the last couple of weeks about the measles outbreak here in the Northwest and how rapidly it seems to be spreading. Why is the number of people, especially kids, sick with measles growing so quickly right now?
Yeah, there are a couple of fundamental reasons why the disease is spreading like this in the region. First, people need to realize that measles is a very contagious virus, one of the most contagious viruses. Measles spreads through the air when an infected person coughs or sneezes. It is actually so contagious that if one person has it, 9 out of 10 people around him will also become infected if they're not protected. So your child can get measles just by being in a room where a person with measles has been recently, even up to 2 hours after that first person has left. The next reason for the spread, according to health officials, is that vaccination levels in some areas have fallen below the level needed to create community immunity, or what we also sometimes hear called herd immunity.
Now, Doctor, a number of people have told us that they had measles when they were a kid and that it was no big deal. Why the big focus on this current outbreak and the renewed push for vaccination?
Well, for many people, it actually is no big deal to get measles, but for some small subset of patients, it's very problematic. So as I mentioned, measles or rubeola is highly contagious. Without the high levels of community immunization, it can spread widely and rapidly. Then people need to realize that the serious complications are also possible. So 1 patient in 4 who comes down with measles will require hospitalization, and some patients can develop brain swelling. These risks can all be avoided by getting the recommended vaccine series, which is 97% effective when properly administered.
Hey, Dr. Bramwell, I want to change things up here just a little bit. The National Blue Association that Regence is part of recently published a new report that looks at hip and knee replacements here in Idaho and across the country. Were there any findings that stand out to you?
Yeah, a couple of things got my attention. First, in Idaho's case, the rate of knee and hip replacements per 1,000 members was a little bit higher than the national average. From a quality of care perspective, I was encouraged to see that the rate of post-surgery complications fell significantly since 2010. It was also interesting to see the favorable cost and quality performance of outpatient surgery centers.
Now, for those who want to avoid or delay hip or knee replacement surgery as long as possible, what advice do you have?
So be active, watch your weight, and eat well. The fact remains that only half of adults meet the recommendations for 2.5 hours a week of aerobic activity. Regular exercise helps keep our muscles strong, which supports our joints and relieves these areas of pressure. Realize that carrying extra weight puts stress on our joints that can, over time, cause lasting damage. In fact, the force you place on your joints can be up to 6 times your weight, particularly in areas like your knees. Finally, adopting a healthy diet can help you shed unwanted pounds and reduce these stresses on your joints.
Well, Doctor, we appreciate the advice. And Dr. Kenny Bramwell, of course, as always, thanks for joining us this morning on KBOI.
Thanks, guys. Good day.